Hello everyone and Assalamu alaikum. Thank you so much for the kind introduction. Hopefully I can do that intro justice. Zaki, it's a pleasure to be here in Pakistan for my second visit. Thank you. I was here a few years ago giving a talk at one of the universities. It's great to be back. And Zaki is a pioneer. Zaki has led not just in Pakistan but globally, the journey, the inspiration for many of us to think about digital health innovation across sectors. So well done on him for the 22nd year of this conference, well ahead of the curve. So I'm going to spend the next 15 minutes or so talking to you about my interest in AI with a couple of 3 stories to share and 3 things to show you. First of all, I thought I'd show you something new. So I'm going to put these glasses on first of all. These are AI glasses. AI is around us everywhere. These are the latest AI glasses from Meta, Ray-Bans. And they are programmed with Meta AI, so I can talk to my own glasses constantly, looking around the world, etc. In fact, I'm going to walk around now. Also, I have a display in my right eye, which you can't see, with all my apps, all my platforms I can access. So if I walk around now, and I'll walk around, I'll say, hey Meta, record a video. A light will come on. Yes? I'm recording it. And I can set that recording. It's okay, it doesn't matter. I can send record now to my Facebook, social media. I can then record things as I wish. Hey Meta, stop recording. Let's go. Hey Meta, take a photo. Everybody? Thank you, that photo's there, I can see it in my eye. And next thing I'm going to do, we can turn the whole thing on. I can see the whole platform here. I can see my WhatsApp, my Instagram, Messenger, my calls. I can navigate. I can say to Meta, take me to one of the universities, so directly with a map inside my eye, which you can't see. So I can now use my fingers. I can tap on the side, that's the side that's folded. I can talk to the AI and say, who's this? And if there's facial recognition, it'll tell me who it is. I go to a bunch of ingredients and say, look at these ingredients, what can I talk to them? Or tell me what to cook.
We can't hear you.
Oh, sorry, yeah, I'll come over here. All right, so basically the AI is in the platform. I can literally take a photo, take a video, I can say, take me to a certain area. Google Maps will come up and I can direct myself to that area. I've been playing about this. This only came out on September the 30th. This is the first time these glasses are in Pakistan, by the way. So you get to see them first and foremost. I had to go to New York to pick them up. You can control it with the voice or with your AI platform here, or indeed, even something more amazing. You'll see a band. It's not just a normal band. This band connects to the phone and to the glasses. It uses surface electromyography. My contractions of my wrist allow me to move everything around inside. So if I tap on here, it turns off, turns on. I can swipe right, swipe left, up, down, into a menu. I can hear music. So AI now has become ubiquitous. We're using it every day as we speak. So this is the first time these have been shown in Pakistan. So play around with them as you wish. Welcome. I had to go to New York to get them before I came here. Then we have other wearable technology. Has anybody got a smart ring? What the hell's wrong with you? You're supposed to be smart, right? You're supposed to be digital health, right? Oura Ring is the Oura Ring. It sold 5.5 million around the world, but clearly none in Pakistan or Karachi. They've got work to do. This monitors my health constantly. I wear it 24 hours a day. It gives me AI nudges about my health care, my sleep patterns, my REM sleep, my nutrition, my diet, my saturations. It gives me my own AI instincts. So all around us now, we've been using measurements of AI technology and data. So AI is not just part of an LLM or ChatGPT. It's intimately linked with all of our lives. So I'm going to spend the next few minutes talking about a few examples I'll share with you. Let's go back. Earlier this year, every year at CES, which is a consumer electronics show in Vegas, they have a big keynote. Jensen Huang, who's the CEO of NVIDIA makes the microchips, of course, silicon chips for AI, and their company's worth $2 trillion. He gave this picture of AI in the future. From AlexNet, which is this one here, in 2012, the first paper came out of convoluted neural networks. The first time we'd seen these networks being used. That was a seminal moment in our society, an inflection point for humanity. It's because of these neural networks we have LLMs now. Only 13 years ago, developed by Alex Karofsky and Geoffrey Hinton. Geoffrey Hinton is the father of AI. So without that, we wouldn't have LLMs. So he talks about this cycle where we are with the chips. We're now going from generative AI to agentic AI, and the future will be physical AI, what's called AGI, artificial general intelligence, where we are now going to have computers that are more powerful than human beings. Some people say it could be in 10 years, some people say maybe in 10 or 15 years, but it's coming at some stage. AGI is the ultimate aim for artificial intelligence. We call something called ACI, which is Artificial Capable Intelligence, which is what's possible today. So that's the kind of concept to go back forward. Of course, in 1992, we had the launch of ChatGPT, which changed our entire lives with AI platforms. And there's a huge deluge of AI platforms as we speak all around the world, right? Whether you use Perplexity, whether you're using Mistral, Gemini, ChatGPT, and it goes on. Actually, it's quite an index of your AI understanding. How many of these do you use in your normal routine practice? I use about 7 or 8 now, routinely. So the question is, how many are you using on a regular basis? I suspect it's just OpenAI and ChatGPT, but it's a measure of your understanding of technology. First of all, what's agentic AI? Let's just think about it. So here we are, here's the definition. Agentic AI refers to AI systems capable of autonomous decision-making, planning, and action. Unlike traditional AI prompts, tools that require prompt engineering, it's autonomous. It makes its own decisions based on what's fed in. And these operate a level similar to a human assistant. That's agentic AI. That's the next level of AI platform we're looking at. So they're autonomous, they have a goal orientation which you program into, they're context aware, they're persistent, maintain their memory across different conversations, and they're interacting with humans on that level. So the dynamic processes that we work with. If you look at traditional AI, which requires prompt engineering, one task at a time, no memory long-term strategy, agentic AI operates independently, it executes multiple step tasks and has memory, it learns from experience. That's the kind of difference between normal AI, which you use, and agentic AI. And there's lots of use cases around the world, from monitoring to decision support to coordination patient care, and of course my world of surgery, which is now being revolutionized by AI-powered surgical devices. So this is one of the companies I've talked about, is Quadrivia. I chair the board of Quadrivia. We launched our own agentic AI earlier this year, and we're expanding globally in the US. What does it do? This is our platform. Hope the volume works.
The most important and universal challenge in all of healthcare everywhere in the world is that the demand for health services far exceeds our ability to meet them.
We've brought together clinical leaders and healthcare innovators from around the world to help create Q. And here they are, introducing Q.
Hi there, I'm Dr. Fernandez. Tell me a bit about you.
Hi, Dr. Fernandez. I'm Q, a comprehensive AI clinical assistant built by clinicians and the patients we serve.
Great. Can you walk me through in more detail what you can do? For instance, how can you help in a typical consultation process?
Sure. So when dealing with a patient who comes for a new consultation, I can manage history taking, provide some hypotheses, suggest investigations, propose appropriate treatment plans, and recommend local specialists.
How about managing a patient with a chronic condition?
I can help with the ongoing management of patients and help with any routine clinical workflows across a wide range of conditions. Some of these workflows have already been prepared, but clinicians can also build their own custom workflows to support their patients better.
That's very useful. Can you talk through what makes you special?
I'd love to. I have a robust cognitive architecture that comes from the orchestration of LLM-based systems tailored to perform specific tasks or subtasks. These are known as agents. Using those agents, I provide responses grounded in my clinical knowledge base, which combines a range of sources and medical guidelines that are then validated by our clinicians to minimize hallucinations. Finally, I aim to combine all this with a patient's health record, which brings together data from EHR systems, clinical notes, and previous patient conversations.
And how do you ensure safety?
I'm constantly on the lookout for red flag symptoms that might require emergency attention or that may be indicative of critical issues. If patients ever mention symptoms that are a cause for concern, I will redirect them to get support from a real-world clinician to ensure that the patient's safety is never compromised?
That's enough for now. We'll have more videos to follow. We'll let people test you for themselves. Yes.
So we produce an AI platform that's comprehensive, that can be customized. So each person in this room can customize the AI for their own clinical practice or their own clinical needs. Our white paper is available on the website, of course, and this is our complex architecture, using an orchestrator middle, using LLMs as a back end to create that unique interface of AI. And we're using it now for lots of routine clinical journeys. This is kind of a concept of what we create now and how you create the platform for yourself.
Thank you. I'd like to retract to patients that haven't done their smear test yet and explain to them why they should do it.
Would you like me to give you a short draft of this task?
Yes, please.
Here's a draft for your clinical task. 1. I'll reach out to patients who haven't completed their smear test and ask if they have any questions or concerns about it. 2. I'll explain the importance of the smear test.
So you're training the AI just by your voice, saying go to my electronic health record, find the patients for a smear test, phone them up, let me know how many are responding. Purely automation. Takes a lot of workload from clinicians. And it will learn. Every time you add a new thing, you'll add that to the clinical workflow and add it as it's completed.
What do the UK guidelines say about how often to do this test?
And by creating these guidelines, you're now saying we are now creating a hallucination-free agent that can be useful to me individually, which is different to somebody else's. I have my own AI agent. Before my patients see me, they go to my AI agent, takes a history of colorectal disease, comes to the clinic, the history is already there, saving me 15-20 minutes of valuable time before I even see the patient. It will make a tentative diagnosis as well, but at the moment, AI is not there for a class 2 medical device giving you a diagnosis. It's supporting clinical diagnosis. I'll take you to this picture here. This is René Laennec from about 1860. Do you know what this device is, by any chance? Anybody? This is the original stethoscope. Yes, the thing that you create. This was first creation. It was a rolled up piece of paper or a tube which you put onto the person's chest. Listen. This was the first stethoscope from 1860. 150 years later, we still use the same device. We use a hollow tube with earpieces and a bell to listen to people's hearts and abdomen. Why has it taken 150 years and no disruption of this one device? Well, now we're different. Now we have AI-powered stethoscopes, which I'll share with you.
What does innovation mean in the hands of those who heal? It's more than technology. It's a promise. A promise to care deeply, to listen closely, and to understand truly. Introducing AKGUN. Crafted at the intersection of technology and precision. Here, the absence of wires isn't just aesthetic, it's freedom. Every gesture reaches further, enables teamwork, leaving a lasting impact unconstrained by the conventional. In the heart of every caregiver, there lies a relentless quest to turn silence into a symphony of insights. In every corner of this bustling world, listen to the purity of life's sound. Every heartbeat, every breath, an orchestra of sounds, pure and undistorted. A future where every note of health is heard, understood, and valued.
We'll just pause for a second, clearly. Happy Karen? Assalamu alaikum. Nice to meet you. Yeah, Karen, thank you so much. So, as we were saying, so you saw the stethoscope from 160 years ago with no change. What do you think about that new stethoscope? Amazing, right? It's the future of healthcare. Oh yeah, the audio is pretty poor, but I'll show you, but I'll go back. Can we go back one slide? Okay. Okay, let's stop from here as well. Okay.
What does innovation...
I'll show you back. So, Zaki, Dr. Zaki, you're a physician, right? Or you were one many years ago. What's this thing here? That's a stethoscope, the very first stethoscope from 1860. Now, I was saying to the audience here, in 150 years, there's been no change. We still have a tube connected to a stethoscope and a bell, right, and a diaphragm. So that's been not disrupted for 150 years until today. This is the next concept generation of AI stethoscopes.
What does innovation mean in the hands of those who heal? It's more than technology. It's a promise. A promise to care deeply, to listen closely, and to understand truly. Introducing AKGUN. Crafted at the intersection of technology and precision. Here, the absence of words isn't just aesthetic, it's freedom. Every gesture reaches further, enables teamwork, leaving a lasting impact unconstrained by the conventional. In the heart of every caregiver, there lies a relentless quest to turn silence into a symphony of insights. In every corner of this bustling world, listen to the purity of life's sound.
So we've taken 100 years disruption now to a new model. It's amazing, right? That is the Apple of stethoscopes. Who would prefer the old one or the new one? The new one, right? And here we are. Here's your first one that's built in the world, okay? A new AI stethoscope. And what you do, and let me see if I can plan it. There we go. Let's start working on it. So it has two things. It auscultates. So here we are. It lights up. You put it on your chest with Bluetooth connection, and you can hear heart, whatever you are. AI will tell you the diagnosis. AI will listen to the heart murmur, tell you the diagnosis straight away. Listen to the chest. So, Minister, please, play around with that. I'd love to use to see it. So, I can, let me hold a second. I'll see if it's still alive, yeah? So this recording, you can listen to the Bluetooth or here. You can then send that to another physician, and if that's here, I get Dr. Zaki to join the conversation with you. Give me a second opinion. I can stop it there. If I go to here, I can now place this on here. This becomes my AI agent. I'll speak to you. This records everything, puts some textual context to the front calculator, giving a diagnosis. So Dr. Stethoscope is your whole AI agent built on a beautiful device. What do you think, guys?
Great.
Very cool, right? Yeah. Pass it around. Let them play around and explain the concept. So we'll show you.
Hey, you forgot.
Oh yeah, I have forgotten it. Thank you so much. Thank you so much. So I've shown you two new worlds first. Minister, we were showing earlier the new AI-powered glasses. These have display on here. I can see lots of display, my apps. I can say, hey Meta, take a photo. I'm taking a photo. Hey Meta, take a photo. Hey Meta, record a video. It's recording, right? So now I'm recording the audience on AI. I can control it with my arm. You haven't seen this, Zaki. This is the first time this is in Pakistan. It came out 2 weeks ago in the US. I was in New York, picked one up. It's controlled by my arm. I can swipe left, right, up and down, tap into modules out, all using the display here. So these are the first AI glasses in Pakistan. You must try them. If you put those on, I'll turn it on at the back. Just put them on, and then you should see a display.
What the doctor is saying is that how much is true?
You can do that, of course. So these are AI devices. They're ubiquitous in our lives. They're everywhere. So we'll just carry on with our presentation. Last bit. So I did the AI agent that we showed earlier. We showed you the stethoscope, AI-powered. Now we'll show you my world of surgery, how we're changing our world of surgery. Digital surgery is a new concept in our world. We went from analog surgery to become digital surgeons. I'm a cancer specialist in London, and now we're seeing this complete new world with a connected healthcare system, with remote collaboration, with data AI-driven platforms, robots, and of course, the world of extended reality. This is our world now. Forget analog surgery. We're using robots, AI navigation. We're using smart technologies to drive innovation across our health systems. And surgery is so exciting currently. In fact, I'd say my 32 years as a doctor, this is the most exciting time I've been around in the world of medicine. We've seen autonomous cars. A Tesla, I have a Tesla at home. If you go to the US, you can jump into a Tesla. It drives you somewhere to another place with no driver in between. It has autonomous driving. So we use the same computer navigation skills in surgery. This is a cholecystectomy, a gallbladder operation. And the one area we have of concern is the area of the cystic duct and colon bile duct. If you divide it, you damage it, it's bad news for the patient. For the first time, AI now helps us interoperatively navigate about what's going on in the operation, about where those structures are, giving you real-time advice and navigation interoperatively for the first time ever. So now we have surgical AI helping surgeons become better, more efficient, with less complications. Fascinating time to be alive. This is the world's first autonomous surgeon. This surgeon, which is a robot, joined two bits of bile together autonomously. Can you imagine? It's what I do for a living. My job's at risk, clearly, from the AI. But it did an operation for the first time in the world. And the world of robots is coming in. There are now 120 companies in the world producing surgical robots. I'm sure you've got plenty here, the Da Vinci, etc., robots in different hospitals. They're getting smaller, more sleeker, and more cheaper and more affordable to democratize healthcare on a global level. But here's the thing. This is a robot trained by other robots. Yes. They fed videos into the robot of other robots doing operations and said, learn the operation. The robot learned from robots. Can you imagine the world we live in? There's no human intervention. Robots learn from robots. So now you can train robots on other robots. I think I'll be out of a job fairly soon. I'll be coming to Pakistan to look for a job very soon, Dr. Zaki, if that's okay with you. We're collecting more and more data. The surgical theatre is awash with data. We haven't collected any of it so far. We've become analog, very much old-fashioned way of operating. Here, another company I sit on the board for is using computer vision, cameras in the OR, to plan the efficiency of an operation. This is high tech. Do you remember Amazon fresh stores? Have you been to Amazon stores before? Amazon, you go to a store, some of the stores, you go in, you apply the QR code on your phone, you take what you want, and you walk out. The AI would tell you what you bought and charge your account, right? We've taken the same technology here. This is the OR, using surgical navigation. Imagine this in your AI-powered operating theatre. We're collecting all the data points from 8 cameras on where the patients are, what the surgeon's doing, the actions of everybody in that room. We then map out the timings, show what's happening in the OR in real time using AI computer vision. We map it out for the hospitals, make it more efficient, to allow this operation to go through much more expediently. So we're now deploying that across the world in different hospitals. Happy to come to Pakistan, of course, and deploy AI agents, as always, to showcase what's happening. Ladies and gentlemen, I've taken a whistle-stop store. I can talk a lot about AI and the applications. If you want to follow my work, it's profshafi.com is my website. I share constantly every week newsletters on exponential technologies. At the moment, I'm writing a book on healthcare, so be prepared to have one of those soon. I write about AI all the time, because I think AI is so fast-moving. It needs people like me to keep abreast of the news to help support that information transfer. So that's my AI Horizon newsletter on my website. And I do a lot of posting on LinkedIn, as Zaki will tell you, sharing my thoughts from a global perspective. So do share and follow me on LinkedIn and share my newsletters and access my website. It's been a quick journey. I'm so sorry it's been so fast, so rapid. The world of AI, we need to be abreast of AI. We need to understand it, not be afraid. It's overwhelming sometimes. It's for you to understand the limitations, the ethical considerations, the bias, and how we adopt AI successfully, safely, so that we're about patient outcomes all the time. If we put patient safety at the heart of our minds, then deploying AI isn't a risk. So thank you so much for the invitation, Dr. Zaki, as always, and lovely to meet you. Thank you.